Happy Hypoxia. In 2020, when the world woke up to the COVID-19 pandemic, our lives were completely stalled and normalcy was thrown out of the gear, as no one knew what was happening. As the virus started spreading across the globe, it was indicated by medical experts that the most common symptoms of the virus were regular flu, cold, dry cough, etc. However, as the virus started spreading and mutating further, new symptoms were discovered including pneumonia, breathlessness, diarrhea, loss of taste and smell, formation of clots in the blood vessels, etc. The latest member to join the long list of COVID-19 symptoms is something called happy hypoxia or silent hypoxia, meaning very low levels of oxygen in the blood. Happy hypoxia has left medical professionals across the world baffled. In today's video, we have talked about everything you need to know about happy hypoxia or silent hypoxia. Subscribe to our YouTube channel for more such videos. We post new videos every week. What exactly is happy hypoxia or silent hypoxia? The COVID-19 pandemic holds many mysteries. And one of the most baffling mysteries of the pandemic has been happy hypoxia or silent hypoxia. Hypoxemia is defined as a reduction or decrease in the partial pressure of oxygen present in the blood vessels. As the oxygen levels in the blood begin to reduce, patients can experience a symptom called dyspnea or shortness of breath. And if blood oxygen levels fall drastically, the organs may shut down and the issue can become life-threatening. The normal oxygen saturation in a healthy person's bloodstream is above 95%. However, COVID-19 patients can show a decrease as low as 40%. Hypoxia is a warning sign for imminent failure of organs and is accompanied by shortness of breath. But happy hypoxia doesn't have any external signs. That is why, in the initial stages of the disease, patients appear to be alright or happy and thus may not show signs of the complication. Since COVID-19 is primarily a respiratory illness, happy hypoxemia can be a common and significant symptom. Why do oxygen levels fall in COVID-19 infected patients? According to research conducted by medical experts, the primary cause of happy hypoxia is coagulation. Coagulation refers to the widespread clotting that typically takes place in a complex network of tiny blood vessels present in the lungs. The underlying factor behind happy hypoxia and a decrease in oxygen levels is an inflammatory reaction in the body. The inflammatory reaction is most probably triggered by the SARS-CoV-2 infection. The infection in turn instigates further cellular protein reactions that can form blood clots and prevent the cells and tissues in the lungs from receiving enough or adequate oxygen supply. Pulse oximeter and COVID-19. A pulse oximeter is a compact and portable device that can measure the number of oxygen levels in your system. It uses a non-invasive technique and can rapidly access readings of blood oxygen saturation along with heart rate. To use a pulse oximeter, you just have to clip it firmly to your fingertip, and the device then painlessly analyzes the two wavelengths of light from the blood that is flowing through that region. One wavelength determines the oxygen levels in the bloodstream, while the other gauges the pulse rate, which means how fast the heart beats. Doctors have said that the pulse oximeter is one of the crucial must-have health monitors needed in every household. Since the coronavirus infection is a contagious illness that can affect your breathing, especially in the upper respiratory tract. It eventually damages the lungs when the virus transcends to the advanced stages. Thus, a pulse oximeter is a very useful gadget that can aid in detecting falling levels of blood oxygen concentration in the early phases of the infection. A pulse oximeter therefore can alarm you much before the infection manifests into something more severe and complicated. This would assist in isolating the patient and providing immediate medical care for those affected by the virus. As the COVID-19 situation is intensifying in India, with the onset of the second wave, more than 2 lakh people are testing positive daily. The infections are spreading rapidly, and people as young as in their early 20s and 30s are getting affected. An alarming observation that has come to light is that happy hypoxia or silent hypoxia can develop in the younger population as well. Prominent signs have not just been noticed in the younger population, but also in those who are asymptomatic or just have mild symptoms of COVID-19. These people may still experience a state of decreased blood oxygen concentrations or happy hypoxemia, happy hypoxia in asymptomatic people. Even if someone is experiencing mild symptoms of the COVID-19 infection such as fever, sore throat, dry cough, etc., without any breathing difficulty, it is advisable to keep measuring blood oxygen levels. As we discussed, this can be done with the help of a pulse oximeter. Other indicators of decreasing blood oxygen concentration can be when the color of the lip changes from pink to a red or purple appearance. Persistent sweating without any physical activity such as exercise can be another red signal for decreasing blood oxygen levels. Thus, it is important to keep an eye out for these signs before identifying happy hypoxia and isolating the patient to provide him with prompt medical care. This is everything you needed to know about happy hypoxia or silent hypoxia. Remember to stay safe, wear your masks, and get vaccinated when your time comes. With these small yet significant steps, we can overcome the second wave. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.